Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Science and Pharmacy in St. Louis with their podcast titled Dose of Knowledge. We give credit to Professor Stephanie Lucas and Terry Walholick for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Now let's hand the microphone over to our students.
It's 11 p.m. on a Sunday night. While most college students are asleep, pharmacy students are busy setting up the vaccine clinic for the next day, energy drink in one hand and vaccines in the other.
Welcome to Dose of Knowledge.
We are Tinley Smith,
Carson Morgan,
Abir Coldy, and Emily Liu, and we are second-year students at the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis.
Today we are discussing the many ways pharmacy students are making an impact, both inside and outside of the classroom.
And when you think of a pharmacy student, what usually comes to mind?
Probably someone stressed out,
Buried in textbooks,
Wearing a white coat,
working in a lab,
or studying late into the night.
But there's so much to us than that. Pharmacy students are actively participating in speaking out about issues within pharmacy, local neighborhood, and within healthcare all around the world.
We would now like to welcome our guest speaker, Associate Professor and Director of Community Partnerships, Dr. Amy Tiemeyer. Welcome, Dr. Tiemeyer.
Thank you for having me.
Dr. Tiemeyer, how do you think pharmacy students are making a difference?
Students are active participants in all aspects of our healthcare system. For example, our P4 students have required rotations in community and health system or hospital settings. In the community setting, they are a vital part of vaccinations, both at the community pharmacy and at immunization events in the communities in which they are based. In the health system and hospital setting, they are providing education to patients about their medications and give input to other healthcare providers on monitoring of medications and the best medications given individual patient factors.
Thank you for sharing. Those are some really great points. Pharmacy students are making a change all around the world. For example, the students at the University of the Pacific's Thomas J. Long School of Pharmacy are making an impact through their mobile Medicare clinic by providing important medical services directly to the people who need it most.
At the Massachusetts College of Pharmacy and Health Sciences, students are helping the elderly with managing their medications, listening to the general public's concerns, and speaking out for change within healthcare.
Furthermore, at St. John's University College of Pharmacy, students are participating with elementary schools to educate kids about the importance of blood sugar management, explain the roles of pharmacists, and teaching safe uses of over-the-counter medications.
Dr. Tiemeyer, could you please share a specific story where pharmacy students truly changed lives?
Sure. As part of our P2 Introductory Pharmacy Practice course focused on patient care, students meet with seniors in our community. One of the activities they do with the seniors is a Medicare Part D check. Because of the information the student pair provided to one of our seniors, the senior was able to save a significant amount of money by switching Medicare Part D plans during open enrollment. The saved money was half of what that senior needed to be able to get new hearing aids.
That is an amazing example. Thank you so much for sharing. Pharmacy students from around the world are proving that the work that we do goes way beyond the classroom and is making a difference in the people around them.
Dr. Tiemeyer, when you were a pharmacy student, what big change did you want to make?
When I was a student, I wanted to help patients improve their health. I saw so many patients who didn't understand their medications or why their medications were necessary. I knew that with the right education, they could improve their medication adherence, which would improve their quality of life for years and even decades to come.
Thank you for sharing. That definitely would have a big impact.
And here at the St. Louis College of Pharmacy, our students are making an impact both on and off campus.
One of the big events that we host each year is the Walk By Clinic, held in partnership with the American Pharmacy Association right on the campus quad. Every October, pharmacy students volunteer to provide important health services to our local area, like blood pressure and blood sugar checks, free vaccinations, and even at-home tests, such as HIV, syphilis, and COVID tests.
And that's not all. Volunteers also hand out free condoms, Plan B, and provide easy access to health education materials. This is an amazing event that shows how pharmacy students are stepping up to help with public health needs. Last year, the Walk By Clinic information reached just under 100,000 people through national television and just under 300,000 people on local news stations. The volunteers were able to provide 95 free vaccines and 44 blood pressure checks to the general public.
Another powerful way we make an impact is by standing up for change. Each year, pharmacy students from all across Missouri gather in the state capital, Jefferson City, for the Missouri Pharmacy Association Legislative Day. Last year, we had 210 students and 31 faculty members attended Legislative Day in Jefferson City. We meet directly with people of power to speak out for the profession of pharmacy, share personal stories from our experiences, and give voice to patients' views.
And some students also held a clinic at the Capitol to help the people in the local area. The volunteers were able to do 19 blood sugar tests, 5 blood pressure checks, and they handed out 120 Narcan kits and educational materials. It is important for our legislators to understand the important role pharmacists and pharmacy students have on healthcare.
It's also a great opportunity for students to build professional connections and for the legislators to see how passionate we are about pushing for change within our field of study.
And beyond being a voice for our patients, St. Louis College of Pharmacy students also give back to the local people through volunteering. Every November, we celebrate Founders Day with a campus-wide day of service.
And students volunteer all across the St. Louis area at the botanical gardens, the animal shelter, and at a local food pantry. Some make cards or blankets for patients in local hospitals. Last year, the university had 249 students, 43 faculty members, and 75 members participated in this effort to give back to the local area.
No matter the setting, pharmacy students from the St. Louis College of Pharmacy are showing that we are not just the future healthcare providers, but we are active members in our cities, making a difference one step at a time.
Dr. Tiemeyer, how is the program here at St. Louis College of Pharmacy preparing pharmacy students for their future careers?
The program at Stillcop provides a broad education to its students, including hands-on education in Skills Lab, comprehensive body system knowledge through the Integrated Pharmacotherapy course series, and leadership and management knowledge in a variety of administrative science courses. They also get real-world experience through introductory and advanced pharmacy practice experiences in various healthcare settings. There are many elective options in the didactic and experiential courses that expose students to the vast array of pharmacy careers that are available as well.
That's a great point. And to continue on that topic, how has the schoolwork for pharmacy school changed over the years for pharmacy students?
Well over 100 years ago, pharmacy school started as an apprenticeship program and has transformed over the decades to become a 4-year graduate program that requires multiple years of foundational undergraduate work prior to entry. We used to only require advanced pharmacy practice experiences, but now all students get 300 hours of introductory experiences as well. The curriculum has also changed to keep up with advancements in all areas of healthcare to ensure that our students are knowledgeable about all areas of health, including public health, health equity, and preventative medicine. We have integrated our clinical content with the medical sciences, so students are learning about the science of disease and treatment together. We also have more variety in the types of learning modalities we use, such as skills labs, teams-based learning, flipped classrooms, and OSCEs.
I would agree. The schoolwork for pharmacy students can be very hard at times, but it is important because it trains students for their future careers.
Dr. Tiemeyer, is there any advice you would like to give to a student who wants to be a leader?
I would advise a student to get involved. They may not know exactly what area they are most interested in, but should try a few things. Once the student finds an area they're passionate about, they can help out with events and take leadership roles in organizations that have that focus. That involvement will many times lead to attendance at local, state, and national meetings where they can learn more from experts in the field and do networking to find out about additional leadership opportunities as they advance in their career.
Today, we've explored just a few ways pharmacy students are making a difference in healthcare, health around the world, and bettering their local neighborhoods.
As pharmacy students ourselves, we know it takes dedication, hard work, and resilience not just to succeed in the classroom, but to actively contribute to our local area.
And it's no secret that healthcare education can be challenging, but everything we do is driven by one goal: to make a positive impact on our patients and to continue to support the field of pharmacy.
So here's our ask for our listeners. Support pharmacy students, explore pharmacy as a career path, and stay informed about how we are shaping the future of healthcare.
Thank you for listening to this episode of Dose of Knowledge. Be sure to check out the other episodes for more insight into the consistently growing world of pharmacy.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.